Have you ever stopped to think about how doctors could possibly know what was going on inside our bodies? Way before x rays and all the fancy scans we have today? Well, it turns out that sometimes all it takes is a quiet room, a pair of really sharp ears, and your own fingertips. Today, we are diving deep into this incredible technique called cardiac percussion.
I mean, it sounds kind of like a superpower, right? The ability to actually map out the exact borders of a living, beating heart without making a single cut. But it's not magic. Not at all. It's a brilliant, time-honored clinical skill.
So the answer to that big question? It all comes down to a technique called percussion. And trust me, it's this amazing blend of art and science that's both super simple in concept, but wow, profoundly clever in practice. It's all about learning how to see with your hands and your ears. This is honestly the perfect way to think about it. You know when you're trying to hang a picture and you tap along the drywall, you hear that hollow sound and then suddenly, thud, it changes. You found a solid stud. Well, our bodies work on the exact same principle. Your air-filled lungs sound completely different from the dense, muscular heart right next to them. So what's the actual medical science at play here? Let's get into the nitty-gritty of the technique, which has a very specific name and a very important purpose. And there it is, percussion. That's the official name for this art of tapping. The whole key, the secret sauce, is that the sound that bounces back tells a story. It's a story about what's hiding just beneath the surface. Now this is where it gets really cool. A doctor is basically listening for two very distinct sounds. Over the lungs, you get what's called a clear pulmonary sound. Think of it as a resonant, kind of hollow, open noise. But the moment you start tapping over the heart, that sound completely changes. It becomes dull, short, curtailed. That switch from clear to dull, that's the signal. That's the X that marks the spot. Okay, so once you know what you're listening for, a doctor can start a proper investigation. We're talking about literally drawing a map of the heart's true boundaries right there on the chest wall. Every good map needs a starting point, right? So for the heart, we're going to start on the right side. We're on the hunt for the border created by the right atrium. That's the chamber that takes in all the deoxygenated blood from the body. So check out how systematic this is. First, you find the bottom of the lung, then you move up just a little bit to the fourth space between the ribs. And then the tapping begins. You tap, 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 moving from the outside in, from that clear lung sound until thump, the sound goes dull. And just like that, you found the edge of the right atrium. Amazing. All right, let's head over to the other side. Now, the left border of the heart isn't just one simple curve. Oh no, it's a little trickier because it's actually formed by a few different really important structures all working together. And you can see that complexity right here. You've got these major vessels up top like the aorta and the pulmonary artery. But then, forming that main curve at the bottom, you have the mighty left ventricle. This is the powerhouse, the heart's main pumping chamber. So knowing exactly where its border is, that's absolutely crucial. The big landmark on this side is something called the apex beat. That's the spot on the chest where you can actually feel the heart beating the strongest. So you start just outside that point, where the sound is still clear, and you tap your way inwards until you hear that familiar dull thud. And boom, you've just located the outer edge of the left ventricle. So we've got the right side, we've got the left side. Now we just need to find that top edge to finish drawing our outline of the heart. This one's pretty straightforward, actually. You just tap straight down along the left edge of the breastbone. And when that sound finally changes from clear to dull, usually right around the third rib, you found the top of the heart. Okay, so we've mapped all the borders. But so what? What's the point? Well, here comes the real payoff. We can use these points to get a surprisingly accurate measurement of the heart's width, which is a huge indicator of its overall health. This is it. This is where our map turns into a real, hard measurement. We're going to use those landmarks we just found to figure out the heart's total transverse size. All right, first piece of the puzzle. We measure from the very center of the chest out to that right border we found. In a healthy adult, that distance should be right around 3 to 4 centimeters.
And then we do the exact same thing for the left side. Now this side, as you'd expect, is much larger. We're looking at about 8 to 9 centimeters from the midline out to the edge of the heart. And now for the grand finale. We just add them together. A normal healthy heart should measure somewhere between 11 and 13 centimeters across. If that number is way off, it could be one of the very first warning signs that something's not right. And this table just lays it all out so perfectly.
Look at that. 3 key numbers that, when you put them all together, give you this powerful, immediate sense of the heart size. And all of it discovered just by tapping on the chest. It's pretty wild.
So, beyond being a really neat party trick, why does this skill still hold up? What does it truly tell a clinician in the modern world?
This right here is why it still matters. In just a minute or two, with no fancy, expensive equipment, a doctor can get a snapshot of the heart. Is it bigger than it should be? Well, that could be a sign of heart failure. Is it shifted out of place? That might point to a problem with the lungs. These are critical clues that help decide what to do next.
And that really brings us to a final thought, doesn't it? In our world of high-tech MRIs and CT scans, there's just something so remarkable about a skill that relies on the fundamental human connection between a doctor's hands and their patient. It's a powerful reminder that sometimes the most profound insights